you're eating and boy, now you're getting acid reflux or heartburn coming back up, it's another thing should warn you.
So it's third to third.
Love it.
Upper 1/3 is just break the stuff down. Middle 1/3 is like pulling out all the stuff I want from it. Lower 1/3 is I'm holding it here until you get rid of it.
Do I really need this antibiotic? We're like, yes, you have a pneumonia. It's seen on x-ray. You need to get on this antibiotic.
So many of you influencers out there who really not necessarily medical and make our lives hell. But again, we love our influencers.
What up, everybody? Welcome back to What the Health.
Hey guys, how's everybody doing? Welcome back.
All right. Today we're going to go over something around the gut. It's a huge topic. It's something that more and more people are interested about. Read a stat not too long ago. 84% of the U.S. population is now concerned about gut health.
Yeah. Man, it's funny that you know, it's like, yeah, look at my glasses on. Like you're you're big old bug eyed. So for, you know, the umpteen years that we practice in health, everybody seems to always be so fixated on their bowels. Like it's just interesting to
definitely
me.
Different
It's
ages
all
and
about the bowels,
different,
man. Like, and it's like, you know, a lot of it when we start talking about bowel fixations, it's if they're not having a bowel movement every day, or like if they strain a little bit, or a little bit of like stomach cramping, all of a sudden it's like the end of the world, because it is one of those things. I mean, even, you know, from millennia in every old ancient textbook, it always seems to be some story about some GI something.
It's interesting again, and now we're seeing that shift again is going on where there's so much around it. Maybe we can break it down a little bit more around that stuff, and then how do we get a little bit of information to them? And one of the first things we wanted to talk about today, preparing for this, was around how, again, the gut links to different things, right? The gut links to so many different things, but now we know it links to your nervous systems and to your immune system. And maybe that's the first segment we can talk about is, again, how the gut now is connected, or we found is connected to so many different things. I mean, we've known this forever, right? That the gut and immunity, over 70% of your immune system lives in your gut, and that's huge. But in the past, it was all just about bowel movements, as you mentioned, and that was their concern. But we know that it has so much more to do with just your immune system.
If we break down the bowels itself, just to go back to the basics, you know, I always tell everybody when I counsel patients on different parts of like how does the bowel work? What is the bowel? So I always tell everybody, I break it up into thirds. Like the upper 1/3 is really just designed into regards to like breaking the food down, breaking it down to its more minute particles. The middle 1/3 is all about like taking out all the important stuff that we want from it. And the lower 1/3 is just kind of holding on to it until you're ready to get rid of it. Maybe also like getting some extra fluid, extra water out of it if you're a little bit dehydrated. So it's third to third.
Love it.
Upper 1/3 is just break the stuff down. Middle 1/3 is like pulling out all the stuff I want from it. Lower 1/3 is I'm holding it here until you get rid of it.
Right. It's kind of the last part before it goes. And then between that whole cycle, there's going to be different cells that are now involved in, we know, to do those different actions in those areas, but also helps with the immune system, right? And that's why for the longest time, we used to tell patients, you have to be careful because, again, certain things like antibiotics, when they're coming in, they're like, I got a runny nose, I have some, a cough, I really need an antibiotic. And we're like, again, it may be just a viral, and viruses you can't treat with an antibiotic because, again, if we give you an antibiotic, it's going to kill the good bacteria that's inside your gut in those different segments you just mentioned. And if we do that, well, now you've messed off your whole flora. And the interesting thing now is that that's become more of a conversation we've seen in the past where we had to convince patients not to take an antibiotic. Now you're completely flipped because so many people are concerned about it, and they're like, do I really need this antibiotic? We're like, yes, you have a pneumonia. It's seen on x-ray. You need to get on this antibiotic. And now it's like convincing them to be on it.
So many of you influencers out there who really not necessarily medical and make our lives hell. But again, we love our influencers. I'm not saying anything negative about you guys.
It's just being warned about that and understanding that there is, because you still have both sides of it. You have some people who are like, hey, I'm going to go on a trip. Can I just get a whole slew of antibiotics? And we're like, no, that doesn't work that way. You got to know when to take it and when it's right. Otherwise, you're going to mess up your whole gut flora, as we call it. And then that can mess with your immune system and how you fight off infections. And again, inflammatory conditions, because your immune system is not just to fight off infections or to help with digestion. it also helps in terms of just inflammatory conditions in your body in general.
Yeah, it was funny because I was reading some stuff a while back, and they found some old ancient. It was a somebody who was like a Neanderthal something or whatever, and he was frozen, and they actually found parasites in his bowels. I thought that was pretty cool because again, we go back to weird to bring up the topic, but I think to myself again, when people don't realize like our bowels are the entry point of everything into our body, so all the nutrients and everything, and in that process, again, why do we have all these bacteria? Well, because the bacteria help us. They help us digest things. But with that, we've also realized that over the millennia that we've come to grow this relationship with the bacteria in our bowels and our gut, that we've created this like symbiotic relationship where they do just as much for us as we do for them.
Right.
And then there's friendly and then there's unfriendly. And then again, getting to your point is like, that's the whole part about the microbiota or the microbiome.
It's a fun word to say. Microbiota.
Yeah. So again, it goes back to like, then with this, there were parasites who also were like, hey, they were doing their thing to actually grab nutrients from us and live in our bowels and sometimes cause some harm. But again, on the flip side, it's again, there's this whole like, so when we talk about like how much immune systems play in there, because again, that's the vestibule for bringing things into our body. And so we have to make sure that we protect ourselves.
Exactly. So that's where, again, whether it's in your airway and the immune system that's there, or in your gut, which is where most of the things come into our body, is through there. But you mentioned something, and I want to maybe flip over to a new segment here, or the discussion around, again, when we do these things in terms of like the parasites and whatnot, and then how it can impact the gut. Maybe we can talk about now moving into this whole as an impact, and then this whole changes in bathroom behavior or habits and what that could potentially reveal. So if we're talking to everybody here and we're like, okay, because again, that, like you said, it's the conduit, and there's a third of our section that's basically just holds on to things and then gets rid of it for us. During that gets rid of it for us, either through the top, if you puke or you vomit, or through the bottom and you defecate. If there's changes there, what does that reveal? And what can we potentially tell people about this is what it means if these things are happening?
Yeah. So our body has all kinds of mechanisms, again, protective mechanisms. So it's saying like, hey, this is good for you, I want to take it out, and this is bad for you, we need to get rid of it. And in the process of doing that, sometimes it's like, hey, this thing's really bad, we need to get rid of it right now. And if it's in the upper, it's like, we're going to get rid of it one way or the other. It's either going to come up or it's going to go out. And sometimes it's purposeful. Sometimes it's like, hey, this is because there's some disease process going on and it's causing all kinds of issues.
Sure.
And again, that goes back to the immune system, and if it's imbalanced, if it's doing its job, if it's not doing its job, because we've also seen conditions like inflammatory bowel disease, where it's like all of a sudden the immune system starts going bonkers and doing things that are attacking our bowels and causing issues for us.
Autoimmune, sure. Yeah. If you could, like us, follow
Subscribe,
us.
Follow all the stuff, make sure that you hit the like buttons, all those different things that
Ring
people
the
are supposed
bell,
to say.
do the thing you're supposed to do, hit the
Backflips,
subscribe thing,
triple
whatever it
somersault.
is.
Come on in.
Send in the pigeon, carrier pigeon in.
Smoke screens, it's cool.
However else it is that you can. Again, make sure you're following us, and hopefully you'll learn a little something and you'll have some fun.
Yeah. What the hell?
So yeah, I like that. So again, if we're bringing it back down into chunks, the 1/3 there, if something is inside there and it's not supposed to be there, you'll vomit it out because your body's trying to get rid of it. But there's also times where, from a pathology perspective, where if you're eating and boy, now you're getting acid reflux or heartburn coming back up, it's another thing should warn you that, and if it's happening frequently enough, especially if you're a male and you're over the age of 50, and if you're having this on a regular basis and you're taking Tums, you're taking these proton pump inhibitors like Prilosec and Zantac and some of these other things over the counter, and it's not getting better, you got to let us know, because now we're start talking about, well, that's not normal, and that should be a red flag that if it's going on for long enough, you got to come in, see a provider, because that is going to trigger potentially things like Barrett's esophagus or some changes, in other words, inside the upper third that can lead into some scary stuff.
Yeah. And that's always unfortunate with some of the things, some of those conditions. If we catch it early and we fix it, everything's good. Some of those, though, if we don't catch it, they can get pretty bad pretty fast. I mean, I've seen patients go, have some serious issues with, that pretty fast.
Exactly. So now we're talking esophageal carcinomas and, again, really bad issues.
Stuff. Yeah. I mean, just like, those conditions can go bad real fast, and it can be difficult to treat.
And then on the other end, again, bathroom habits on the other side of it is, again, if you start to notice things that probably would want to tell people to be warned about, like, again, obviously, things like if you're seeing blood, right? If you're seeing blood in the stool, that's a concern. Now, if it's not just blood, but now you're also seeing things like mucus and it wasn't there before, or the stool caliber, we call it. So it's starting to come out and looks like more like a pencil and coming out in long strips like that. And that wasn't normal for your body, bowel habits. That's another concern.
Mm-hmm.
And you mentioned something too, like inflammatory bowels, where now, again, where you're going back and you're having pain or you're trying to go, but it's not coming out. Those are things that we also want to make sure that we're looking for too.
So like blood, mucus, systemic symptoms, when we talk about like fever, body aches, night sweats, rashes that are unexplained with a lot of bowel symptoms, even joint pains in the low back, all these things can be symptoms and manifestations of a process that could be related to some inflammatory bowel something. We talk about celiac. I mean, celiac was like forever,
gluten,
like
sensitivities.
yeah. I mean, how many?
We could talk hours just on the sensitivities out there and food allergies and the different things and intolerances and. But again, from a stool changes, there are also some patients will come to us and they'll say, "Hey, my stool has changed," and we're like, "Oh yeah, they have," and then they're like, "Yeah, it used to be green, but now it's brown, but it flips back and forth," and you're like, "The color, I'm not as worried about. It's still meaningful. It's more of some of these other things that we have to be concerned about because those are the ones that we're really looking for from a provider perspective."
Mm-hmm.
Right?
Sure. So it's upper, middle, and lower. And then it's things like indigestion, heartburn, chest pain or pressure, bloating, gassing, bloody, mucousy, stools, nausea, vomiting, unexplained, diarrhea, unexplained, associated with what we call systemic constitutional symptoms, weight loss, fatigue, skin rashes, joint pains, and bowel symptoms. All these are things should be red flags that like you need to come on in. Right. Let's get you looked at. If you're pumping a bunch of Tums and Prilosec and Zantac and all these different things, and you're still feeling like, hey, food's stuck, or it hurts when I eat, or I'm feeling like I want to puke, or like I'm choking when I'm laying down at nighttime on my own,
absolutely,
vomitus or whatever. These are all things. Get your butts in, literally, so we can check them out. See what I did there? But yeah, so. What about probiotics, man? People always ask about like, "Hey, doc."
I love that. So let's flip gears now and move into this whole thing because again, like I said, 84% of the population in the U.S. is now fixated. I would say probably it's more than that from what we see. But again, are fixated on their gut. One of the things that we hear a lot about is what do I need to take in, and probiotics, prebiotics, and all of that. And then again, what's real, what's not real, what's hype, what's just...
Which one should I take? What brand should I take? Whatever. Right. How many times have you seen people come in with bottles of like 30 different things? Like, which one should I take? And you're like, look.
Yeah, exactly. So, and then it goes back to, again, do they even need to take it? Should they be doing those kinds of things? Or is it, no, you should just be eating more regularly? Obviously, we're always going to go back to the natural route, right? We're always going to go back to the way nature intended it. Right. And the way nature intended it is for us to have a variety of foods and have certain things inside our body that's going to help us to keep the gut biota healthy. And the way you're going to do that, of course, is going to have a variety of foods. And what foods specifically? It's going to be your fiber foods and your fermented foods. If we can keep those things in there now, we throw that out there, but you got to remember too, like if you're somebody who gets a lot of gut bloating, then fermented foods and fiber foods can increase that. So just be careful with that and watch for that as well.
Yeah.
But if you're really interested in really getting your immune system in your gut as well as the gut digestion better, you're going to need fiber. You're going to need the fermented foods.
Yeah, for sure. So now also go back to our roots and our basics, as I was mentioning. When we look at our ancestors and where the region of the world that you come from, there are parts of the region of the world where our ancestors for the last 5,000-10,000 years were okay with living on like cow or milk products like dairy and have no problems with handling like lactose or lactose, containing stuff. But for the majority of the rest of the world who didn't live on that staple, their body doesn't handle lactose well. And once they get through childhood, they can't even look at anything that has any dairy in it because they will get bloated,
intolerances,
things like that. And then there's other parts of like where individuals in the world who are their ancestry was raised on things that are like gluten and or gluten types of proteins, and they have no problem. But then there's other parts of the world where their ancestors had no interaction or contact with gluten type stuff. And when they get that stuff in there, they start getting all these different ranges, a wide spectrum of like gluten types of tolerances or sensitivities. And it could go from just like mild intolerance to like full-fledged celiac disease, where they're tearing their intestines apart and they're not absorbing things and they're having all kinds of serious issues from childhood.
Yeah. Great visual tearing your gut apart.
Right.
So one thing that going back to the how to protect your gut again, so taking in fiber, and people always ask, well, what's the right amount? And we always go back, it depends on the person, their size, and what they're eating. And then the fermented foods, and probiotic rich foods are going to be things like yogurts, right? Is a good one. Anything that again, kimchi's, your kefirs, these kinds of things. But again, back to your point, if you come from a certain area, again, in the world, and your sensitivities, you may not want to take certain foods that are high in probiotics because it may actually cause more gas and bloating. So you have to be careful, and it's a trial and error until you find the one that is going to be best for you. So that's an individualized thing. You're going to have to kind of go back and forth. And yes, the amount of fiber, so that way your stool is relatively consistent in terms of how much is coming through. Again, it could be 5, it could be 10 grams per day, but those are the things that you want to watch for. And again, when you're looking at your food nutrition labels, you're going to be looking at your carbohydrates, and then you're going to be looking at dietary fibers. So what's the amount of carbohydrates, and then what's the ratio that is from fiber, because that's really what you want to do. And then, of course, you want to back away from your simple sugars, because the simple sugars are the ones that they're going to be the ones that cause the bacteria to essentially grow, because what do bacteria live on? Simple sugars.
Right.
So if you're eating processed foods that have a lot of carbohydrates that are simple carbs, you'll see that on the food nutrition label. You want to make sure that you're avoiding that, and you want to make sure that your total carbs and your fiber carbs are in a good ratio with a low amount of simple carbs.
Yeah. And to just elaborate a little bit more on what Greg was talking about. So when we look at fiber, or look at carbohydrates, the carbohydrates are like, fiber is really carbohydrates that our body can't digest and break down and absorb. So that the more of the fiber that we take in, the more of this carbohydrate that just stays in our bowels. And what that does is, when we look at the way, this is again getting a little technical, when we have something in a tube that doesn't get absorbed, it pulls fluid into it osmotically. And so the more fiber you have in your bowels, the more fluid it'll actually pull from your body to keep the stool nice and soft, instead of like having it where we have the opposite. So again, that's why fiber is good for you. If you want to keep your stool soft and you want to have soft bowel movements where you're not straining and pushing out the hard stools that are causing bleeding, or the rectum, and all the different things that we've heard, see.
All the fun stuff.
And that's the other thing. So if it comes out bright red and it's like you were straining and pushing hard and it comes out bright red blood, that's probably you're tearing something, or you're having some hemorrhoid that's getting irritated because you're straining too much and your stools are not soft enough. That means you need to definitely increase the fluids and increase that fiber.
It's probably a good time for us to then switch over to, well, when is it a good time to then come in and talk about these things in terms of like, hey, I'm having these symptoms, right? That you just mentioned, or some of them. So let's maybe talk about that, as when do patients need to come in and get tested, and how could we potentially help them with some of these things?
Yeah. So maybe we kind of like give you the visualization. So you have like a white rag, and then if you have like what we say red flag, meaning blood all over this flag.
That's the one.
See what I did flag, there too? Yeah. So if we talk about waving the red flag, so that's what we talk about, so what are the red flag symptoms?
Right.
No, weird visualization, right? Now imagine this bloody flag.
So speaking of that, blood is one of them, right? So anytime that you would vomiting blood, that's a no-no. You got to come in and get it seen. Obviously, if you're also having blood from the rectum and you don't have hemorrhoids, or that you know of, and you haven't had any reasons why that would happen, then of course you need to be seen as well. So that's an easy one, right?
Sure.
What about bloating? Because we get a lot of that too. We got, I'm starting to get bloated. When would we say that, hey, bloating is an issue and we need to see a patient? And what other symptoms would we want to see patients for?
Right. So anytime when we have these red flag symptoms, so bloating can be common with just you ate the wrong food, didn't sit right with you, but bloating with other myriad of symptoms, meaning like red flag symptoms of bloody mucousy stools, cramping, weight loss, other constitutional symptoms. You're looking more pale because now you're getting anemic. You're having fevers, night sweats, bone pains, joint pains, skin rashes, bloating with any of those kind of things. certainly should be running in. It shouldn't just be kind of like, gently walking in. You should be running in. No, I'm just kidding. But you should be seen for sure. Those are like, for me, red flag symptoms. Like if you're having like, bloating, pain, discomfort, but you're having a change in your bowel patterns, meaning now all of a sudden you're having bloody mucousy stools, or you're having pencil-like stools, or you're straining, or you're having like nausea and vomiting and bloating. All those are like red flag symptoms that you should be coming in.
For sure. So things like, again, you guys got to remember that there's going to be things that we always say are going to be red flag things. And those are going to be if you're starting to get night sweats, you're getting unusual weight loss and you're not trying, or if you're starting to see blood, or if there's a consistent change in your bowel habits, even though you haven't changed your intake in terms of your nutrients and how you eat things, but now you're starting to notice that your bowel shape, form, or consistency is off, but you haven't changed anything, those would all be reasons why we would need to see somebody. Obviously, prolonged nausea, as we just mentioned, certain age ranges with acid reflux that's not getting better, despite change and, after you reduce your acid intake and those kinds of things that we want to see those individuals.
And as you mentioned, there's certain gender related things. So when we talk about like esophageal issues and or Barrett's or something like that with males, people who smoke, there's a lot of conditions associated with like, alcohol,
sure.
caffeine. We know that certainly like for Asian genetic ancestry, high risk of gastric cancer. These are all things, unfortunately, we had a good dear friend of ours, a physician who had just died not too long ago of gastric cancer. So these are all the things that, again, we know that certain genetics put individuals at higher risk for certain things. And there's certain populations or pockets of individuals who have a higher risk of inflammatory bowel disease, certain pockets of individuals higher risk of celiac disease.
So if you smoke or vape and you're having consistent symptoms, you got to get seen. If you got a strong family history, or if you come from certain areas of the world and you're having those kinds of symptoms, you got to get seen. And things like you just mentioned, like if they have, if you got psoriasis or eczema and you're having gut symptoms, there's sometimes or joint symptoms with that, you got to get seen. Those are going to be all reasons why we'd want you to get in, get tested, because there's all different types of conditions that would, you're going to want to come in and make sure that you don't have those unusual conditions. So
awesome. So I mean, we covered a lot of stuff. I mean, the bowels are an important organ, and we hear a ton of questions on that. I feel like that's probably one of the biggest things where like when many times the patients come running in, and because people tend to be so fixated on their bowels, but there's also a lot of misinformation or disinformation on there in regards to like the stuff of like taking certain things to kind of help with the cider vinegars and all these different things, or you can get down all kinds of rabbit holes of all the different remedies, the folk remedies that people have had over the years, and all the things that we've heard and the try before they come in and see us, and you're like, why'd you wait so long? You should come in, but again, it's important.
No judgment though. Again, it is what it is. But the thing is, there are certain conditions you don't want to wait long for because you do want to get in. And again, those are things that if you're starting to notice, boy, I'm taking more and more over the counter stuff to treat this. Again, don't want to avoid coming in because you're just masking it, and there potentially could be something really serious that we're missing out on and we're not testing. So you got to get in, get those things tested, and really get a diagnosis before you're just kind of masking it with potentially other things that also have side effects, right? So maybe that's the last thing we can talk about is when you're taking these medications or over-the-counter stuff, when is a good time or signs that you probably need to come in and do things? So
that's a great point. I mean, when we look at now, a lot of the medications that forever were only by prescription are now over the counter. So like the Prilosec, the Previses and those kind of things, and a lot of the Zantac and the Pepsids and the Tagamet's and all these things that were 1 point prescription, thankfully are now over the counter. But that also means that people tend to like try to just self-medicate their way through a bunch of things where they're just like popping, Prilosec after Prilosec or, Pepsid after Pepsid, and or they're, taking all kinds of like other things that even, the supplements and nutraceutical based stuff or, the holistic based stuff, and they're self-medicating, and next thing you know, they come in and their pill is a ghost because they've been having a slow bleed somewhere now for the last 6 months.
Not even that. Now we know too, if you're taking those medications long-term, it can impact your kidneys, right? And if you're taking those medications long-term, it will impact your digestion and absorption of certain vitamins, B12s and things like this.
Calcium, magnesium.
And then that can impact your bones, your joints. It can impact, key other areas in your body. B12 gets impacted if you're taking those things on a regular basis, and then all of a sudden you're anemic again.
Right.
So that's why if you're taking these things and you're relying on them, and boy, I'm starting to take these things on a regular basis, my symptoms are gone, but you're taking them continuously because otherwise your symptoms will come back. You know that you probably need to come in and get seen too, because anything over a couple of weeks of taking those things or the symptoms recur, you got to get seen.
So that's a great point. So for me, the rule of 2 weeks, so if it's 2 weeks and you're doing something and you're having to do it more, that you should be coming in. Like, don't wait, because we need to then work together. It may still wind up being where we keep you on some of this medication, but then at least it's kind of more being monitored and managed the right way with monitoring levels of certain,
Right. Then we're checking your vitamin Ds, we're checking your B12s, we're checking all the other ones we know, and your kidney functions, because that's cool. You're going to take it because we've made sure nothing else is going on, but we also have to make sure that it's not causing any impact either.
Right. So then it's in a monitored, controlled system, and then you're good.
Awesome. So I think we covered a ton of things around the gut here again. So yeah, all kinds. And again, it was very colorful discussion today. So again, let's if we wrap it up, and let's get everybody back, hopefully interested in the next topic we're going to be talking about on
What the Health.
All right, guys. So we'll see you back soon on What the Health, and hopefully we learned something about it. If you're having symptoms for a long period of time, come on in, give us a call, email us, get scheduled.
Right.
And then
don't forget to hit the like, subscribe, all the stuff.
All right. See you guys soon.